Information from RFSU about genital mutilation. Genital mutilation of girls and women is common in approximately 30 countries today. This tradition is also sometimes called female circumcision. Most girls are targeted when they are between 4 and 15 years old. This procedure has no support in any religion, and it's a crime against the rights of children and is contrary to the UN's Convention on the Rights of the Child. In Sweden, genital mutilation is illegal, and more countries are banning the procedure. This is valid regardless of who performs the procedure, even if it is done by a medical professional. There are no medical benefits to female genital mutilation. Some believe that it makes women clean and that it is good for hygiene, but this is incorrect. Instead, it is associated with the control of girls' and women's sexuality. Parents may experience significant pressure from their surrounding community to perform genital mutilation on their daughters. They may view it as a way to ensure their daughter's future, since unmutilated girls may be more difficult to marry off. This means that individual families can have difficulty giving up the tradition without support from society at large. Genital mutilation is extremely painful and can cause problems for the rest of the person's life. In certain cases, portions of the labia and clitoris are cut off, often without anesthesia. Sometimes the clitoris may have been marked with a sharp or pointed object. The crudest form of genital mutilation involves both the labia and the outer part of the clitoris being cut off. The genitalia are then sewn together, and only a small opening remains through which urine and menstrual blood can pass. Following the procedure, it is common to have severe pain and to experience bleeding and infections. In the worst cases, victims are at risk of dying due to the genital mutilation procedure. Those who undergo the crudest type of female circumcision may have difficulty urinating, along with recurring urinary tract infections. It may be difficult for menstrual blood to flow out, leading to pain in the abdomen and pelvis. Not everyone experiences difficulties, and levels of severity vary from person to person. It depends on the type of procedure that one has undergone. Being subjected to female genital mutilation can also make it difficult to have sex. It can sometimes be painful. Girls or women in this situation may feel desire but have difficulty experiencing any enjoyment. In such cases, it is advisable to seek help from the public health service. Enjoying sex is all about getting to know your body and what feels good. Those who are experiencing problems or have concerns may contact a healthcare center, youth clinic, or gynecological clinic for assistance. Those who are attending school can speak to the school nurse. At Stockholm's Södersjukhuset Hospital, there is the Amel department, which specializes in helping circumcised girls and women. People from anywhere in Sweden are welcome. No referral is needed prior to the visit. Today, there are more and more parents who do not wish to circumcise their daughters and who choose to abstain from doing so. There are also an increasing number of countries that have banned female genital mutilation. In Sweden, you can get a certificate to bring with you if you visit your country of origin, stating that female genital mutilation is illegal and may not be performed on your daughter. As a parent, you can seek help and support from school, the school nurse, the youth clinic, the child health care center, social services, or the police. All girls have the right to not be the victim of these abuses.